If you or someone you know uses insulin, understanding the best practices can make a huge difference in managing blood sugar levels effectively. Let's start with basics. Where to inject your insulin? The most popular site is the abdomen, your belly. But why there? When we say abdomen, we are talking about the area under your skin, not the stomach itself. Under the skin, you have a nice layer of fat called subcutaneous fat. The importance of this area is that it has fewer blood vessels, which allows for slow and steady absorption of your insulin. When you inject insulin into this fatty layer, it mimics the body's natural slow and steady release of insulin, keeping your blood sugar levels in check. Plus, it's pretty painless. Nowadays, we have got the shorter needles like the 4 mm ones, which are great because they make the process easier and less painful. Just poke straight in at a 90-degree angle. No need to pinch the skin or anything. But why not inject into your muscle? Well, injecting into the muscle can cause insulin to absorb too quickly. This absorption rate increases substantially with exercise due to increased blood flow to your muscles, leading to a sudden drop in your blood sugar levels and increasing the risk of hypoglycemia. Additionally, injecting into the muscle can be more painful. So to avoid these issues, patients are often taught to lift a skin fold or angle the needle at a 45-degree angle. But with these shorter needles, that's not necessary. Now, let's go over the proper injection technique. If you are using a 4 mm needle, simply inject straight in at a 90-degree angle. For 5 mm needles, you need to pinch the skin before injecting. If you have to use a 6 mm needle, pinch the skin and inject at 45-degree angle. Now, let's talk about where else you can inject. Besides your abdomen, you can also use your thighs, upper arm or buttocks. Each site has its own advantages. For example, the abdomen provides quicker and more predictable absorption. Remember to avoid areas with scars, moles or blemishes. One important step is site rotation. Each time you inject, rotate your injections within the site by at least 1 centimeter, that is width of an adult finger. Or you can divide the area into 4 sections and move from one section to the another. This helps to prevent lipohypertrophy or lipodystrophy, which is a fancy term for the abnormal building of fat under the skin. Lipohypertrophy can occur if you don't rotate your injection sites properly or if you reuse your needles too often. One study suggested that if you reuse a single injection more than 5 times, the risk is higher. If you inject insulin into that fatty tissue, insulin absorption will be less effective, causing unpredictable blood sugar levels. So the important message is that never inject insulin into the lipohypertrophy tissue. There is no gold standard technique for diagnosing lipohypertrophy other than using your eyes and fingers. You can see it as a raised rubbery areas and can feel like a nodular or hardened lump under the skin. So to summarize, use 4 mm needles whenever possible and inject it at a 90-degree angle. Rotate your injection sites within and between different areas of the body. Avoid injecting into lipohypertrophy sites. Inspect your injection sites regularly for any changes. Do not reuse needles and dispose them safely. Injecting insulin doesn't have to be scary. With the right technique, it can be a breeze. Don't forget to subscribe for more health insights and share this with anyone who might benefit. Until next time, stay healthy, stay happy and keep smiling through it all.